Verbal communication, speaking and interpreting, is so vital to being human that many assume that when one loses that ability, one loses their mind. His mind is still churning, probably working overtime. It's his brain that's been bashed. So what's it called when someone loses this ability? It's a disorder known as aphasia. Aphasia is an impairment of language that affects a person's ability to produce and comprehend speech, and their ability to read and write. This is Peter, Maria, and Robert, and these individuals were kind enough to share their experiences living with aphasia.
I can think about it, but talking aloud is something else.
Okay. So it's all in your head?
Yes.
But getting it out?
Yes. I can read it. Right in the head, but in the now what?
Okay, so it's reading it out loud.
Yes.
Yes, that's hard.
Because it means not really understanding.
Okay. How about speaking? Do you have any troubles with that, or not really?
I do sometimes.
Okay.
It affects me both in understanding what people say and also in speaking. I have to really concentrate on when somebody is speaking to me, and I get very bothered by other noises and distractions. I have trouble kind of putting the different words together and finding it's not really finding, as you know, I am finding specific words, but it's finding the words that put the entire sentence together at times, and then sometimes it can flow okay.
So what causes aphasia? Aphasia is caused by injury to the language centers of the brain. The most common cause of brain injury is stroke. A stroke is when there is a blood clot or a leaking or burst blood vessel that blocks blood flow to parts of the brain or damages brain tissue. When there is no blood flow, brain cells die. Some other causes include traumatic head injuries, tumors, infections, and progressive neurological diseases like dementia.
So I have trouble with giving instructions and placing orders and things like that. My biggest problem is dealing with doctors and dealing with a question and answer session. Not like we're doing here, because you've given me something written to help as well. But like if I'm in a doctor's room and they say, well, when did you have your stroke? When did you? And they're just quick fire questions. And I have to think of the answers quickly. Yeah.
It's hard.
It's hard?
Yeah.
What is hard? Are you thinking of communicating?
Yes, that's one way of putting
So it's hard to communicate?
So in my mouth.
Okay.
Yes.
So talking?
Yes. I can speak to you if
Okay.
I I know what to say.
Yes.
But
But getting your message out.
yes, yeah.
Okay.
It's gone down.
Gone down?
Yes, yeah.
Okay. So your friends,
I have them in my mind, but calling them
It's not really good.
not really? That's good.
I lost all my social life apart from family. Nobody could talk to me, and I couldn't talk to them, so I got a lot better now, but
Yes, yes.
in that time, I lost all my, what I thought were friends. I guess they're not. I have speech therapy, and yes, it helped a lot. But I would get, shall we say, homework to do. So I would take from that strategy. I would then spend the rest of the week practicing that. But the biggest thing was dealing with the frustration.
Okay.
So finding ways of coping when I couldn't find the word, finding alternatives, and concentrating. We worked on, let's try to get it right. We worked on trying to get the flow correct.
So the big question is, how do you treat aphasia? Following a brain injury, a lot of changes happen to the brain which help it to recover. As a result, people with aphasia often see dramatic improvement in their language and communication ability in the months following the injury, even without treatment. However, some aphasia still remains after this period. In these cases, speech and language therapy is used. Speech and language therapy aims to improve the patient's ability to communicate. To do so, a speech and language pathologist, or SLP, helps their patients to use their remaining language abilities, restore language abilities as much as possible, and learn other ways of communicating. People with aphasia can seek to have individual therapy that focuses on the specific needs of the person. They can also partake in group therapy, where they can use their new communication skills in a group setting.
I love it so much. At least I've got many friends from around here.
Yes, I do like speaking to them, but that's not
Why you come?
why I come. Hopefully,
Dealing with aphasia?
yes.
Yes? Okay.
But it's the social side, that's a big part of it. It's a safe place to practice.
Most importantly, as humans, we often tend to make generalizations and assumptions about various diseases and disorders, which can lead to major misconceptions. One of the biggest myths surrounding aphasia is that it affects intelligence. In reality, aphasia has nothing to do with intelligence, but instead with language. Just because someone cannot understand you or cannot find the words to fully express themselves doesn't mean they are less intelligent. Intelligence and language are completely separate. Here are some community resources across Ontario that could potentially benefit individuals living with aphasia and their families. They will also be included in the description below. Thank you for listening. Please like and subscribe if you enjoyed this video.